We are live. Hello, ladies.
Hi.
Hello.
Hello.
Wow. Fee and I are so excited to have you on Breast Cancer Awareness Month. We all know someone who has been affected by it. So we wanted you courageous women to come on and tell your story. And we also have a doctor to share some information as well. So I'm Red,
And I am Fee, and we
and we
are
are
Inspire Woman,
Inspire Her.
the total woman.
All right.
Not half a woman, the total woman.
The
Guys,
total woman.
listen, we are very excited, as Red said, to have everyone here tonight and to honor these ladies and all of those out there who have experienced um, breast cancer, who are survivors or those who have gone on and left us, and we still honor them as well, and family members, because we all know that the survivor is surrounded by family members and friends and all those who love them. So we all are affected by it. We absolutely love you, ladies, and truly appreciate you guys for coming on. Listen, like for those of you who are listening, please like our pages, Inspire Her page on Facebook, YouTube, Instagram, wherever we are. We're trying to inspire women as much as we can, and we need your feedback. So, like today, if you have anyone um, who has gone through breast cancer or who has passed on, please put their names in our on our page or in this chat if you are listening to us. We want to honor each and every one of those tonight.
Right. So let's introduce our amazing guests. We're going to start at the top with Miss Delores Armstrong. Tell us a little bit about you.
Hi, my name is Delores Armstrong, and I am a 4-year breast cancer survivor. Yay!
Michelle.
Hello, my name is Michelle Watts. I am a 3-year survivor. And my mom also had breast cancer as well
Mm,
as an aunt, so I had a history of it. So, yes, I'm just waiting for that 5-year mark.
amen.
Yes.
Hello, everyone. I am Dr. Donna Adams-Pickett. I am an OBGYN in Augusta, Georgia, but I also like to refer to myself as a woman's healthcare warrior. I'm here in the fight with you for all of our GYN related diseases, and this month in particular, breast cancer.
Thank you. Welcome, ladies. So, first, we want to just take a moment of silence for those who we have lost. All right. Thank you. So, Dolores, talk to us about your story. Tell us about your journey through this process.
Sure, absolutely. Um, so I always had my mammograms. So that's the very first thing I would say that is very important to do is never to skip a year, because I know even skipping a year can be, um, you know, a game changer. So with me, I did have a mammograms every year, but in October of 2018, um, they wanted me to come back for a second time, and I'm like, okay, if you say so. And then they wanted to do a biopsy because they said they saw something that didn't look the same from the previous year. Um, so it only took maybe about a day for that to come back. And my husband and I went to the visit. And that's when they said I had breast cancer. Um, the where my I have what they call dense breast. So it would not have been detected from a self breast exam. So, which is another reason why it's very important to get your mammograms, and hopefully people can also get the 3D one so it can get a better
Mm,
picture. So I would not have detected it via a self breast exam. So thankfully the mammogram did pick it up. Um, of course, I was a myriad of emotions that day. It was very numb, didn't know how to feel. I was like, really? Are you serious?
Mhm.
And I remember it very clearly. It was like a Thursday night, and um, it was a choir rehearsal night. And my husband like said, "What do you want me to do?" I was like, "You know what? Just go." My husband works nights, so I was like, "You know what? Just go ahead to work," because I didn't know what to do, how to
Mhm.
feel. I went to choir rehearsal, sat in the back, and trying to process things. Went home. A couple of my girlfriends came over. We cried and did all of that. But I will say that the team of doctors at MCV, Massey Cancer Center, are awesome. A couple of days later, after I was diagnosed, they had a team in place. Um, my husband and I went to um, Stony Point, and we met with the whole team. It was an all-day process.
Mhm.
Each member of the doctor's team, explained the whole process from beginning to end, and that kind of eased, our, the way we were thinking. Um, I will say, without God in my life and my faith, I don't think I would have, gone through this process, with some source of peace.
Yeah.
Of course, I had, what my what ifs and what's going to happen and that sort of
Mhm.
thing. But definitely, staying prayed up. My support system, my parents, my sister, my posse, my
Mhm.
husband, you know, having a support system is absolutely key.
Mhm.
Um, I had to go through radiation. Thank God that when they tested my lymph nodes, the cancer, did not go there. So I
Good.
only had to do radiation, and then did that for about 30, 40 days. Um, and then with the radiation, um, they say, you can get tired, but for me, I wasn't really that tired because you have
Mhm.
to go every single day, Monday through Friday. So I thank God again that it wasn't, it is better than what it could be.
Mhm.
Um, of course, there are side effects from the radiation. My breast was a little darker than what it was, but I'm still here, and I thank God for
Absolutely.
that. Um, my bishop, the late Bishop Jared O'Glenn, he
Mhm.
preached a message saying, "My scars remind me that I am healed,"
Mhm.
and I stand on that. Um, yes, we do have to take this medicine that has its side effects. I'm on tamoxifen for 5 years, but again, I'm still here, and I'm grateful for
Mhm.
that. Um, so since then, I really wasn't, as far as nutrition is concerned, I really wasn't a bad eater, I wouldn't say, but I
Mhm.
have been more conscious of, what I eat. Um, I have lost 30 pounds, thank God. Yay.
Yeah. I see you running marathons and doing walks and stuff too.
Yes, yes. I joined a group called Girl Trek, which is the African American walking group here in
Mhm.
was actually is nationwide, but I joined the Virginia one.
Mhm.
Also, my church has a breast cancer support group, so I joined that. And then also there's a breast cancer support group called Sisters Network, which is also nationwide.
Mhm.
So I joined that. So again, having support systems, talking to people who have gone through the journey and the fight with you, helps a lot. Even though everybody's journey is different, there are some, similarities of what things, you go through and side effects and that sort of thing. So it's helpful to hear other people's stories so you know that you're not alone. So,
Right.
yeah.
Awesome. So I forgot to talk about the title. So it's Cancer, You Picked the Wrong Girl. Sophia and I have these t-shirts courtesy of 428. So that is shop 428. So want to give a shout out to her for these amazing shirts. All right. Thank you, Delores. We're gonna come back to you.
You're
Michelle.
welcome.
Hi. So, my healing story is similar to hers because I was at
Mhm.
VCU also, and they are a wonderful team. I actually, like I said, my mom had breast cancer, but my breasts have always been very cystic. So I remember my mom has since passed, but I remember the first time when she was alive and I felt something in my breast and it was just like my heart dropped. And so she said, "It's okay. I'm going to go with you." We went for an ultrasound and it was just one of the cysts was inflamed.
Mm-hmm.
So I had those off and on throughout my life. So when I felt this first, I thought, "Oh my gosh, another cyst." I remember the first two times I'm straight to the doctor. After that, I was like, "Oh, cyst."
Wow.
And that kind of threw me into a sense of that's what it is. So when I first felt it, I said, "Okay, sis." And then the way things work, I went on an eating binge. So I gained like a lot of weight. I didn't feel it anymore. I kind of puffed up. Said, "Okay, I need to work out. So I need to lose this weight." So at the beginning of the year, I slimmed down and it was still there. And I said, "No, this is
Wow.
not, yeah." But even, and this is just how you are sometimes, you said, but maybe not. You don't right away. I say you have that sense of it can't be, and I don't want it to be. And I hate to admit, but that was me at first. I said it's not. So finally I said, yes, let me go and get it take care of it. But I also at that point, I had been so used to feeling my breast cystic, I kind of, how you know. So when I got the diagnosis, I wasn't quite like Deborah. It was kind of Delores. I'm sorry. I was like, I knew. And
Oh,
so just like her, though, they went straight away within a matter of days. They had that team in place. And I think that team or that method was kind of new at that time where they had everyone at the same place at Stony Point. So like she said, throughout the day, they gave you lunch. You saw the oncologist, the radiologist, you saw the person, I saw a nurse practitioner,
Yep.
you saw a social worker that connected you to like resources. And so everyone examined you in the morning and then they met around noon. And in the evening, they had the complete care plan
Right.
at the end of the day. Yes. So I had 16 rounds, 16 weeks of chemo and radiation, but I had, they found it in like, I think 1 or 2 lymph nodes. And so I actually had the mastectomy on the right side. So I chose not to get a double. And I went back and forth with it as far as my care. And I remember my mom did not have both breasts removed. She never had a reoccurrence. She said it was my decision. So that's just kind of what I decided. So when she eventually passed, and that was like 30, 40 years later, she never had a reoccurrence of her breast cancer. She
oh,
passed
wow.
away. Yes. So yeah, I had a reconstruction on one side. I had after the first surgery, I had something, it was like a really big, kind of painful, fatty deposit under my arm that never went away. So my very last surgery I had which was another reconstruction on the left side. They actually had to take that out. So I had a couple of surgeries because of this. But like she said, it was my support system. So when I originally was diagnosed, I'm the type of person that I keep things to myself. That's something I've learned not to do. So I didn't really kind of confide into a lot of people. And then very gradually, I told maybe 1 or 2 friends, and I told them in a group chat. So I had another friend. She said, "Well, Michelle, you need to do a Facebook page so that we can support you." And I'm going, my first thought is, I don't want to do that. I don't want to people, I don't want to bother people. They have to feel like they need, She said, "No, we want to support you. Do a page." So I did a page, and I invited quite a few friends to my page. And when I tell you that is the best thing I could have done, and I'm so grateful to her because so many people joined. They sent messages every day. I had one girlfriend when I started chemo, they did a schedule and they posted it to my page and people signed up. I had a ride for every appointment. Sometimes
Wow.
people, I wish I could share the pictures. I should have thought to send them to you. I still have those pictures. Every time I went, I had 2 or 3 friends with me. They would dress in t-shirts and they bring me a t-shirt. We would have so much joy and support in the when I was getting my chemo. Some of the nurses be like, "Shh, come on, y'all can't be laughing." They boosted me up. Every appointment was just like a sisterhood. It was wonderful.
Mm.
They would the schedule will get full and they would say, "No, we need a day to go." And they said, "Well, 2 people can go." And sometimes I had 3 people with me.
Wow.
So I am so grateful for them. And
Yeah.
they were such a blessing through the whole thing. So I know what she means about that support system. It really made a difference.
We do have a question for you. Crystal
Okay.
Marie wants to know, how was the relationship dynamic with your mom, being that she had already experienced this? I'm sure that was tough, especially for a parent.
Well, this is the thing. She actually passed before I was diagnosed.
Mm.
Yeah. Now she was around when I had those scares, and I could tell, she was a little shook during the scares, but she was always the one, because I am the type of person that I'm going to think the worst first. So she was like, "No, you don't know anything yet. Don't get upset. I'm coming with you." So she was really supportive. But yes, she passed before I was diagnosed.
So I know it's probably, kind of a crazy question, but did you guys go through a depression when you found out, and how did you cope with that?
I didn't.
You did not?
I don't. Well, let's put it this way. I may have. I'm going through some things now that I may find out that some things I didn't think was depression, but I don't remember it. I don't remember being down, I think, because I had so much support.
Mhm.
And I had people that would come by every week, and they like kept my spirits bolstered. Another thing I say is I always had this vision of chemotherapy. In the movies, the people stay with their head in the toilet bowl sick all the time. I had nausea, but I never had the like vomiting and slight nausea.
Oh, that's a blessing.
Yeah, I never had
Yeah.
that experience.
Yeah.
Mm-hmm.
But I hear everyone's different. So
Yeah.
Now, Doc,
I would say I don't think I had any depression either. I don't think I had time
wow.
because because
It was
people
like
were
boom,
all
boom, boom.
like Michelle said, people were always around, and there wasn't a day that someone didn't text me or checked on me. And I think because of the care plan that we had from the physicians, being that we knew what was going to happen and when it was happening and how, I think that helped a lot. So, I mean, they say knowledge is power. So that definitely helped as well, being that we knew what was going to happen and what to expect.
Okay.
Dr. Adams, do these stories sound familiar to you? And
They really do. I think what's really striking is that we have detection from 2 different ways, one from self-detection and one from mammography. And it really just illustrates the importance of how we as women, particularly women of color, need to prioritize our health. We are indoctrinated to put ourselves last. One of the things I usually tell my patients is, if you make a list of all the things that you have to do, typically the one thing you'll kick off your list is yourself. And so in terms of making sure you have that mammogram, have that GYN appointment, or just even doing your basic breast self-exam, we find it very easy to put that aside for ourselves. And so to hear from both ends the importance of going to the doctor and the importance of doing your breast self-exam to the point that you know what's familiar to you and what's not familiar to you. That's the one thing that really sticks out in my mind, is that I believe it was that Michelle, that you had cyst, but you knew that this one was a little different. And that's because you had been doing your breast self-exams.
Mhm.
I think that's an important part. A lot of times, as not even just Black women, as African Americans, it's like we're scared of going to the doctor. We don't want to hear the bad stuff. But breast cancer is not a death sentence anymore if you're able to catch it ahead of time.
Right.
And that's the important thing. That's one of the things that we wanted to get out with Inspire Her, is that it's not a death sentence anymore.
Right.
If you can do your examinations and then back that up with a doctor's appointment to get your mammogram, then you can do early. Ladies did go through, but know that there's an end in sight, and not go through the depression and all the other stuff that we see sometimes, and have a good support group at that. One of the reasons I invited you on here, Dr. Adams-Pickett, is to help us understand how to do this self-examination, and to tell us, along with these ladies, what when we're doing these things, what to expect. Because I think, I do mine, but I think I have, I think I do have some cysts or whatever. But every time I go to the doctor, they're good. But when you first touch yourself, you don't know what you really don't.
You don't.
You are a well-endowed woman like I am.
Right. Well, I'm so glad that you invited me, because even when I have little girls come for their very first appointment with the GYN, they can be 14 or 15 years old. I'm teaching them how to do a breast exam, because again, if you don't touch yourself normally and know what's familiar to you, you won't be able to pick up on what's abnormal. So we talked about me doing this, and if you'll indulge me, I would like to kind of go through with your guests on how to do a proper self-exam. Is that okay?
Absolutely.
All right. Well, first, I usually ask you to stand in front of a mirror without clothes on. So just before you get out of the shower, after you get out of the shower, I usually ask for you, I'm trying to turn my camera down a little bit, for you to stand with your hands on your hips and push your hands into your hips, kind of standing like Wonder Woman. And the reason why you want to do that is because by pushing in with your hips, you're causing the muscles up here to contract. And one of the kind of just like that, that's just like that, kind of like that, you're causing these muscles to contract. And for some of us, our breast cancers first present in the skin. And so we will see the skin kind of pull in or pucker in, like I have here in front of me, a little lemon will kind of look like a little lemon, the little holes on the lemon. So you'll see it kind of pull in like so. Or you'll see something that looks like a spider bite, and you haven't been bitten. And when you see those changes on the skin, it's not necessarily a lump. That's your first sign that something is of concern. Then the second thing you do is you take one hand and put it behind the head so that you stretch out all this tissue right here. And notice I'm pointing from my armpit all the way down to the bottom of my breast, because all of this is breast tissue. Then you take two fingers, take the flats of your fingers, and what you want to do is you're pushing down and then rolling around. You're pushing down and rolling around. So I'm going to demonstrate it on. Ladies, join me. So
Sure.
push down and then roll around, down, roll around. And the reason why you're pushing down, because you're trying to fill that lump that Michelle was talking about, trying to see if it's a cyst. Because most of us have lumpy breasts. Your the milk ducts that are there to supply milk to our babies, they form cysts. So most of us have lumpy breasts, but you're rolling it around to see if it moves. And what you want to do is start in the armpit and you want to go all the way around the total breast until you get to the areola.
Wow.
And do the same thing. So you're pushing down, roll around, down, roll around. And now, what are you feeling for? When you push down, if you feel something that's kind of hard, like this cashew, that's something that you need to bring to your doctor's attention. But sometimes it doesn't necessarily have to be as hard as a cashew. It can be as soft as a jelly bean. And that's what gets most of us. What we're looking for is something hard like a rock or a pea, but it can be like a jelly bean. But see how perfectly round my jelly bean is? Your cyst, your normal cyst in your breast are not going to be perfectly round like that. So when you feel something perfectly round or firm, like my cashew, or it does not move, that's something to bring to your doctor's attention.
You're welcome, Crystal. Wow. Okay.
That's why we're doing this. Is like Crystal said, a lot of young ladies haven't been properly taught to examine themselves.
Yeah.
A lot of us, which is really crazy, don't even really look at our own bodies a lot.
No, we don't.
We don't know. We could have all kinds of things going on, and you don't know until something starts to hurt.
Right. And I like that what you said about starting young, because I actually have a friend whose daughter was diagnosed with breast cancer at 16.
Oh, wow.
Right.
I've never heard that.
And has since passed.
Right.
Oh my God.
Wow.
Right.
I've never
And
heard
that's
of that.
when I first learned about it, you think that is so young.
Right.
You never think.
Well,
Right.
that's how I make it relevant to the teenagers, because of course the teenager, they're coming to the office for the first time. And again, we are often taught culturally to be uncomfortable with our bodies. And so I usually have them do a breast exam. And when you see them kind of check out, I tell them about cases of teenagers who have had breast cancer, and their eyes get wide as saucers. And I say, you know who found those lumps? The teenager themselves, because typically our younger girls aren't coming to the doctor regularly, and they're definitely not getting breast exams. They just happen to take a shower and they felt the lump. So, I encourage everyone to choose one day of the month that belongs to you. I usually choose the day that belongs to my birthday. So it's not just March 28th. The 28th of every month is Donna Day.
Wow.
And on Donna Day, I do my breast exam. And that way nothing sneaks up on you.
Dr. Pickett, what are some of the risk factors? Aside from family history, what are some of the other risk factors?
Other risk factors are smoking. Risk factors I heard both of our ladies talk about their fitness journey, being overweight. So having a very high fat to muscle ratio increases your risk factors significantly. Decrease exercising, because you're just not fit. Those are things that increase your risk factor. And exposure to certain toxins in our environment increases your risk factors.
Okay, so me living down here by this paper plant is probably not a good place for me to be at.
It can be problematic. It can be problematic. But then there are a number of chemicals that we just run into in our everyday lives
Right.
that can, even getting acrylic nails done,
Mhm.
getting certain hair chemicals, all of those things exposes us to toxins that affect our body's ability to do the important surveillance of keeping our cells repaired. And if our body's so busy trying to take care of those things, they can't take care of preventing those cancer cells from
Mhm.
replicating.
Wow.
That's good to know. As I
Mhm.
look at my acrylic nails I have on my finger.
And you don't think about the number of things that you're exposed to on a daily
Right.
basis.
It's true.
Yeah.
Yeah.
That's true. That is absolutely true. Well, ladies, Delores and Michelle, can you help us? If we have some young ladies who are listening, like Crystal Marie and some other young ladies, what would you tell them? If the first day that they do find out, give them some advice on what they should do, what they should, how they felt. You guys said you weren't really
My
stressed.
my first thing would be is to, like, you realize, you say it's not a death sentence. Don't begin thinking negatively, because as we think, so just stay positive and surround yourself with people that will support you and uplift you, because I firmly believe that my friends, and they were actually called Michelle's Posse, that having them with me and around me for each of those visits and not letting me get sad and depressed
Mhm.
had a lot to do with my healing process. So don't start off thinking negatively. Um, Listen to your care team. Hopefully you have a great care team like Delores and I had, and just know that it doesn't mean it's the end of you by any
Exactly.
means.
Yep, I would agree with that. And if you don't have a support system, there are a lot of resources here in, Virginia that you can take advantage of. Like I said, Sisters Network Central Virginia is one resource, um, again, that I'm a member of. And we try to make sure that we go out in the community and provide knowledge and resources to help women. So definitely having a support system, and talking about it. And it's okay to feel, a certain
Mhm.
way. I'm not saying, everything was lovely dovelies. Some days it wasn't. And it's okay. But I didn't stay there. So that's the key. I did stay there. So
Mhm.
yeah.
And I
How
always
important?
did. I said, I would tell my friends, I said, I'm finding the positive in anything. They said, well, what is the
Mhm.
positive of chemo? You said, you lose your hair. I said, yeah, but I lost it everywhere, so I don't have to shave.
Right. That is true.
That's a good way of looking at that.
That's a good way of looking
Absolutely.
at
Right. That's a good way of
it.
looking at that.
You
Yeah.
know,
Yeah.
Dr. Pickens, I've read or I was watching the news and they talked about just the statistics of Black women, even though we make up a small amount of women who actually are diagnosed with breast cancer, we are the ones that die the most. Why
Right.
is that?
Right.
So, 45% of the cancer deaths occur in Black women. And we have a number of barriers. One, we're often underinsured. So, in terms of having access to those healthcare systems and process to get us diagnosed early, so that we can get early treatment, though that's a barrier. We often are diagnosed with triple negative breast cancer, and triple negative breast cancer is the most difficult breast cancer to treat because it's not responsive to hormonal therapy. But one of the things that I think is our biggest hurdle, and I see it from a comment in the chat, that as Black women, healthcare professionals don't often support us or take us seriously.
Mhm.
And as a woman of color who happens to be in the profession, I say you're right. I can't tell you how many times I'm in groups of physician women who have shared stories of going in to see a health care provider, and they've kept it kind of quiet that they were a physician, and they find that they're not heard, that they are ignored, or what we're trying to do is place a one size fits all type of management on women of color, and we can't do that. I mean, even just last year, the American College of Radiology recommended that Black women get their mammograms 5 years earlier than all other women. Have you been told that? Have you?
Only if you had a family history. Only if you had a family history, they talk,
The American College of
Minnesota.
Radiology recommended that African American women start their mammograms, that we start our mammograms at the age of 35 instead of 40, because of the increased incidence of triple negative, because of the higher mortality rate. But we're still dealing with insurance companies and healthcare professionals who want to apply the standard for everyone else on us. And as a result, by the time we are diagnosed, we're way more advanced, and it's too late.
Yeah. Preventative care is important. That's why I'm glad I actually here work for Department of Medical Assistance Services, and we recently approved preventative care across the board as a Medicaid. So, but then we also realize that a lot of people have all of these options, and a lot of people just don't take advantage of them either. I don't know whether they don't know about them, which is a hurdle you try to overcome. And some people know, and like you say, they put it off, and they don't realize that the death sentence that you could be giving yourself is not going. Not knowing is not the death sentence. Not going is the death sentence.
Right.
So, Dr. Adams-Pickett, what would you tell, like you said, the young ladies that come to you? First of all, when should our daughters start coming to you? And then, if you did find something, what's the first thing that you tell them, and how do you help them at such a young age to overcome the fear that they might have right off the bat?
Well, I always recommend my patients bring their daughters to me when they first start having periods, because I want them to develop a relationship with me. We don't have to do a pelvic exam until they turn 21 or become sexually active. But I want them to have a relationship with me so that when they do turn 21, and they do become sexually active, they have someone that they feel comfortable with. They're not meeting me for the first time, and then I'm delving into the most intimate parts of their body. The other reason I like for them to come early is because, again, I want them to have some body positivity and some body confidence. And so I like to, again, teach them how to do that breast exam, because there's another type of breast lump that's very common in young women called fibroadenomas. They are firm lumps, well-rounded, but they move very easily. And typically, what we would like to do is identify them, sometimes remove them, so that the patient doesn't become confused with it later, or let it hide or conceal a lump of concern. But the only way we're going to do that is have them come see their GYN. I don't know too many pediatricians who are doing breast exams. And it's hard for that young woman at 13 or 14 to have the doc who's been seeing their little boo-boos since they were a little baby to start talking to them about their breast. So I strongly encourage all my moms that once your daughters start having their periods, set up an appointment with the GYN that you trust.
I agree with that. Definitely agree with that. Now, like I said, if you were talking to one of those ladies and they did have a lump, or unfortunately, like Michelle said, the young lady who at 16 found out that she had breast cancer, how do you calm a young lady like that down and help her to see that it's not a death sentence at that young age? How do you help them see that? How do you help them understand that they can overcome it, what they need to do? And because at that point, they need to be a part of their own
Right.
success at getting over this.
Right.
How do you help them? I mean, because I know my daughter, she's 17, and I will probably be spastic.
Well, one of the first things I like to do is to find a network of Doloreses and Michelles out there. Because just like Michelle says, she has a public Facebook page where anyone can see how her friends and family have rallied around her, and how they're going to appointments where they're laughing and they're smiling, and they'll look at Dolores's page and they'll see her running a marathon and hooking arms with people, and they're gathering what they see, and they look like people who look just like them.
Right.
Right. Got an ad on TV. And so I always say, I can handle the medicine part. I got the medicine part, but I need you to look at women like this and see that cancer picked the wrong girl.
Right, exactly.
Cancer picked the wrong girl. Look at those women. They're thriving. This is just a bump in the road.
Delores and Michelle, do you feel like your affiliation, support, activity, participation in like support groups will be lifelong for you guys? You feel like this is a lifelong journey?
Actually, unlike Delores, I did not join any like official breast cancer support groups. I don't know why I never felt compelled to. And when I hear her talk about it now, I mean, it's not too late. We're all survivors forever.
Yep.
But I never did. I had my friends.
You already had a huge support group.
Right.
Both of you ladies did. It's been flooding with comments from Delores, and you talked about your team. I think someone came on and shouted you out, and I think that's just so important to have that support, not just from family, but from friends, and them hopefully not being dramatic. Oh Lord Jesus, just kind of like, then they're scaring you, right?
Right.
In my group, actually, and friends were some survivors. So
wow,
yeah, they were
awesome.
there. Yeah, I had a cousin that was a survivor, and I have since had people that were in my support group that were diagnosed after me.
That's
Wow.
awesome.
So we just
So now they're coming to you.
each other.
Right, but they saw you, and they probably said, you know what, I'm not gonna let this define me, because Michelle didn't let it define her.
Right.
Mm-hmm.
Right.
Now, I've heard stories where, unfortunately for a lot of people, it returns. So why does that happen? Or they may have it in one breast, and then they fix that or get that under control, then they'll get it in the other breast. Like, the terminology, the double. I mean, it's just so many different forms of this thing.
And then the medicine that we take afterwards, like she's on tamoxifen, I'm on
Tamoxifen.
anastrozole, and you take it for, I think she's the 5 years after. That's supposed to help, but it is hormone based, so that has the side effects also.
Right. And if you don't have a hormone positive receptor breast cancer, it may not be responsive to it. And the other thing is that we have to recognize is that medical science is not 100% fail safe.
Right.
We are still learning them. They're coming out with new things even today. And there are treatments that were available to us now that weren't even available to us 2 years ago.
Wow.
But the reality is that cancer is cell division gone wrong, and cells divide every day. We can't stop cells from dividing, because we'll never have growth, won't have hair growth, won't have new skin cells. And so ultimately, we never know if we're able to truly and completely eradicate every abnormal cell. There still may be one or two abnormal cells that are still in your bloodstream, in someone's bloodstream, that can still cause cancer somewhere else. It can cause it in the other breasts. It can cause it in other parts of the body. And so that's the thing about us still maintaining our vigilance. You know, I have patients who've been diagnosed and they said, well, I had my mastectomy. I just didn't want to go back anymore. I didn't want to see another doctor. I didn't want to deal with it. But, you know, it's something, it's part of your DNA now, and you have to stay vigilant.
So we have a question. I'm not sure the way it's worded, if you could answer it, but it's, if you have breast cancer, but the treatment isn't working, would you suggest the removal of your breast? Or is that what happens when the treatment is not working? They suggest removal. So
Well,
when
you
does it get to that point?
Well, you know, I can't offer specific medical advice
Right.
in this
That's
platform.
what I knew you couldn't answer the question.
But, you know, it's one of those things, you know, when the treatment isn't working, it could be that specific treatment that is not working. As I mentioned, and as these ladies were mentioning, they're all different types of treatment. Like we used to call the triple negative, meaning that it didn't have estrogen, progesterone, or HER2 receptors. But now they've identified that some cancers actually they're not negative, they just have smaller amounts of those receptors. And now they have treatments that can go for those cancers that have the lower amount of receptors. So that just may not be the treatment for you. There are so many other types of treatments out there. So I wouldn't necessarily say automatically remove the other breast. That's something you would talk about with your oncologist about, is there another treatment for me?
Ladies, I mean, this is just great information. And I am super happy that you guys honored us with your presence because, like I said, African American women, I hear women talk. I did talk to this about with some ladies the other day, and I told them that we were having this episode, and one lady said, which was weird to me, that and she's in her 20s, that she hasn't gone to an OBGYN yet. And that is not, and what I know now is that that's not uncommon. It's, you know, and it's something that inspire her. We want to make sure that we get out there. You have got to go see an OBGYN, have your mammograms, you know, get checked, because there are all kinds of cancers out there, not only breast cancer, and like you said, breast cancer can spread. So you need to regularly be checked. And if you see something wrong, even if there's nothing, I went to the doctor, I had a spot on my leg. And I was like, he was like, Felicia, that's a problem. But I was concerned, you know.
You just need the reassurance that everything is fine.
And just you know, that spot on your leg could have been something else, because I actually, this is something totally unrelated to this, but I went for a spot on my leg. I thought it was mosquito bites, and they just didn't go away and didn't go away. And it ended up being a syndrome that's like an autoimmune Lofgren syndrome, kind of sarcoidosis. And it started from a bump on my leg.
Oh, wow.
So no, don't just say, oh, it's a bump.
Right. And we'll see something and be like, oh, it'll go away in a little while. And down the road, you're like, oh my God, look at it. You know, and it's like, and sometimes it may be too late, where it could have been taken care of. So yeah, ladies out there that's listening, and for those of you who will listen to this on replay mode, please, if you have not gone to see a doctor yet, an OBGYN especially, go. Set up an appointment and go. I know a lot of times we're scared to go to the doctor because we're scared of what might be said. But it's better for you to know now than to find out.
Absolutely.
Also, I wanted to mention someone had in the chat, women with very large breasts, it's harder to feel any types of lumps. And I know that I have a number of patients who say they don't bother to do a breast exam because they just don't know where to begin when their breasts are really large. And so earlier when I talked about putting your hand behind your head, if you have really large breasts, that may be difficult. So what I ask you usually to do is to take this hand and lift the breast, hold it, cup it in your hand, and still do your two fingers, but you can actually hold the breast up with the hand that you would normally put behind your head. Hold that breast up and then just go across, just like you're mowing a lawn. Go across, and it may take you a little longer, but you'll still be able to get every aspect of the breast. So don't let the fact that you may have larger breasts deter you from doing your self breast exam.
Okay.
Thank you for that.
Mhm.
Thank you.
So,
One of the things that we did ask, go ahead, Sharita.
no, you go ahead.
One of the things that we did ask prior to this episode is for those people to put names. We put a post out there and inspire her to put names out there of people who have had or who have breast cancer, or some of those who have passed on. And we wanted to read those names today. We have a couple, to include Delores and Michelle. We had a couple, Cheryl Roberts, which is my aunt. She had breast cancer, and she is a survivor. Don't know exactly how many years. Lynette Farlow, Asia Caree, and then Red and I have a friend from high school whose mother passed on, and her name is Nikita Watson. I don't remember if Nikita has married now, but
Yeah, I can't remember her. But she always posts about her mom on
yeah,
there.
has
Yeah.
passed on, and she has kept her mother's spirit going by participating in breast cancer awareness. And we wanted to just say to all of those women, and I'm sure you guys have some others that you can name, we just wanted to make sure that they understood that support is there.
Mm-hmm.
In your city. I'm here in Savannah, Georgia, and I know that we have support systems out there. It's just a matter of getting online to find those support systems. And then your friends. Michelle was not afraid. I'm not going to say afraid. She just didn't feel the need to let everybody know what was going on. But look what happened when she did. Oh my God. What kind of support is that? Imagine that. And then Delores, I saw Delores has her own hashtag. One of her family members,
Kilo strong.
so strong. So all of that support, guys, it's out there. It is out there. You don't have to go through this alone. Shoot, if you call me and you're in Savannah, I'll go with you.
Right. I have a couple of two things. Yeah. One of my really good friends, Maisha, her mom, Wanda Burgess, she passed on. Survivors, Sandra Latter, she was, she helped my kids in the Boys and Girls Club. So it's just been amazing to watch her story. And then my mother-in-law's friend, Joyce Hicks. So she was another one that I wanted to shout out. Yeah.
And if for those who are watching, if you have names, make sure you go to the post and put those names out there, and we will create a post and make sure that we honor those ladies, because breast cancer awareness is something we are big components of, and we want to make sure that everybody knows how to detect it early. And then once you detect it, know that there are options for you, and that there are support groups out there, and you are not alone. You have option to get some help. My aunt Nadine Brown is celebrating her 10-year survivorship.
All right.
That is awesome. That is awesome. And I want you guys to give these ladies a hand for coming on here and talking to us about their story. It can be hard if you haven't gone on a platform like this and told anyone about your story. So Delores and Michelle, I commend you for being able to do that. And thank you once again for coming out to talk to us We truly appreciate you guys. And you all are
Yes.
pretty in your pink.
Thank
Yes, they're
you.
beautiful.
Rocking
Yes,
pink all month.
you got the wrong girls. These two kick butt.
Yes, yes. So any last words, ladies?
I would say early detection is key. Having a support system is key. Reaching out, looking for resources is key. Um, and if you believe, having keeping the faith.
Exactly.
Absolutely.
And as the good doctor said, those exams, very important because like she said, I had larger breasts and I was still able to feel it doing the exams exactly the way she said. So just because you have larger breasts, it's still very important and you can still detect. So just make sure, pick your day and do your exams.
Right.
Awesome. And we are so grateful for you, Dr. Pickett. Thank you so
Yes.
much.
It's my pleasure. My pleasure. And ladies, just
And
find a culturally competent physician who hears you. They listen to you and they hear you and they're willing to be a partner in your journey.
And guys,
Absolutely.
I definitely would like to commend Dr. Adams-Pickett because I saw her on Facebook in our Jack and Jill Moms group, and I saw her doing a self-exam presentation there, and I just texted her and I said, hey, we're doing an episode, and will you please come and help us understand how to do self-examinations and how to detect breast cancer? And she said yes right off the bat. So
Wow.
thank you so much for that. I truly appreciate that.
Right.
And I
Ladies,
thank you. Well, I do want to thank you for having me. And like I told Fee, my first is she helped me overcome something else today because my first thought when she said, ask me was, no, I can't do that. And then I had to actually sit and think, one of the things I'm trying to do is not say no, is to say yes, especially
All
to things like that.
Amen.
So she helped me to actually overcome a fear today. So
Yeah,
I
I
thank you
appreciate
for
that.
having me.
thank you. I
Awesome.
told you I was going to be virtually holding your hand.
Yes.
Yes, you did. I
On
appreciate
here,
it.
we just like to talk. You know, we like
Yeah.
to talk just like we're talking to your friends. We don't,
Right.
we don't want a stuffy show. We don't want anybody to come on here and feel like, oh, we got to have all this pomp and circumstance. No, you're just talking with your girlfriends in the living room. That's
Right.
what we want to inspire total women to feel like. Next, I want to just indulge me a little bit, ladies. Next week, since October is split, I don't know why they did this, but it's split.
Mhm.
We have 2 awarenesses in 1 month. We have breast
Yeah.
cancer awareness, and we have domestic violence awareness. Next week on October 20th at 8 p.m., we'll be doing this thing again, but we'll be talking about domestic violence awareness and the fact that, ladies, you don't have to be silent anymore about it. You need to be aware what you're going through and fight for yourself. So for those of you who are listening, we will be back in this on Thursday, October 20th at 8 o'clock talking about domestic violence. And we have some brave women who are going to come on the show and talk to us about that. A lot of times women like to shy away from telling people what's going on behind closed doors. But these women are very brave and they are willing to help others by sharing their story. So join us October 20th at 8 p.m. And also, we are doing a retreat. Yes, Inspire Her is doing a retreat, and we are inviting you guys to come. Now, we only have room for 10 ladies, because we want it to be very intimate. We're going to be talking about some things, guys, that may make you cry, may make you laugh, may make you holler out, may make you want to run around the room. You know, we want to, but by the time we leave, we're going to be all hugging each other, loving on each other, and looking for each other the next year. That's what Red and I want to do. We're going to be in beautiful Hilton Head, South Carolina in February 24th through 27th. And some people say, darn, it's cold then. But for those of you who know Hilton Head, the Low Country, Savannah, we only have like 1 month of cold weather down here. It's in the 60s, a little chilly at night, but nothing a sweater and a pair of jeans won't help. We are going to be about 100 steps from 100 steps, not miles, just walking steps from the beach. And we have a lot of things planned. Meditation. We're going to go out on the beach, and Red's going to help everybody give their drama, give their inhibitions, give their stress, and just throw it in the ocean. We are going to have a personal chef. She is from the Hilton Head, Bluffton area. She is she is from the Gullah region, so we are going to taste some great Gullah food. For those of you who don't know what that is, it's just some good old low country cooking, and it is great. We got a lot planned. I am going to talk about finances, and I'm also going to do a session called Vision and Vino, where we create our vision boards for our futures. No matter how old you are, you still have a vision for the future, right? And we're gonna have a little vino, a little wine. So we're gonna do a lot of things, ladies. And like I said, it is going to be 10 women. The information is out there on our page. Yes, yes, yes. The rooming is shared. I don't know how many have been on a retreat before where your rooming is shared. You can bring your best friend, or we can hook you up with a best friend, but your rooming is shared.
You'll be best friends by the time you leave.
Unless you pay for a private room, which is going to be a little bit more costly, but hey, it is a jam-packed weekend and everything is included. Your lodging, your food, all activities, and all supplies. So if you want to come and hang out with Red and Fee, we are more than happy to have you. The house, the pictures of the house are out there. It is a beautiful mansion-style house. So join us, guys. We're going to be in North Forest Beach, Hilton Head, which is a private area, private beach. You're going to love it. You're going to love it. Don't miss out, because people are going to be coming back home telling you about what you missed out on, and you're going to be running to This is going to be a yearly event, so you'll catch the next one. That's all I have, Red. What about you?
I think you summed it all up. Thanks, ladies. Again, this has been amazing. We're getting a lot of positive feedback. Great show, awesome information, inspirational stories. So this has been amazing.
Well,
it's been a pleasure. It's been a pleasure.
Thank you, ladies.
Thank you, guys. And don't forget, for those of you who are watching, like our pages. Tell us some of the topics that you would like for us to speak on. We absolutely love audience feedback. We want to know what you want us to talk about. We can come up with topics, but we want to know that they're impacting you. So please like our pages, YouTube, Facebook, Instagram, and leave comments. We love to hear what you guys think of us. Constructive criticism, that is.
All right, we are ending the live broadcast. Again, thank you from Inspire Her with Red and Fee.
Thank you.
Thank you.
All right, bye.